My name is Peter Cornelis. I'm with Hope for Stroke, and this is the first in our series of interviews with neurologists, stroke survivors, and caregivers, physical therapists, etc. I have with me today Dr. John Pile-Spellman. Dr. John is he's head of the Neuro Interventional Radiology Department, and you have more of a title than that, do you not, Doctor?
Well, I'm here at Presbyterian. I'm an interventional neuroradiologist, and we take care of strokes. I'm the vice chair of the Department of Radiology for research, as well as the director of academic interventional neuroradiology.
Dr. Pile-Spellman, I've had this done to me, but I don't understand what actually happens when you stick a catheter in my femoral artery.
Well, the femoral artery is the artery that goes from the heart and the abdomen down to the leg. This is a catheter, and it's a small tube, about 1 to 2 millimeters in diameter. The tube itself is placed over a wire and is placed back through the femoral artery, navigated into the vessels that go into the brain, so into the carotids. So it goes from the femoral artery, from the groin, into the femoral artery. At that time, a smaller catheter is put through this catheter, again with other equipment, so that it remains, doesn't backbleed and other things. But this is kind of a simplified form. And that catheter then, is placed, is a very small catheter.
Yes.
It is less than 1 millimeter, sometimes as small as 700 microns, navigated into the aneurysm, or the bulge.
This looks very pliable.
It is very pliable because the blood vessels in the brain have lots of circles and twists in them, and they're also very, very delicate.
Mm-hmm.
So this has to go around those vessels without hurting them. The blood vessels in the brain don't have any supportive tissue around them. They're floating, and that's floating. Unlike other vessels that are held by tissues, they're floating, and so it's absolutely essential that you don't put any stress on them.
Yes. This is all very magic stuff.
It is like magic. When this is navigated, an angiogram is performed first by injecting contrast, and then when the aneurysm has been identified, it's possible to advance a small little coil into that aneurysm, and you can see. And
this is done with yet another
with a long wire that is connected to this coil, and that coil is detachable. And there are a number of mechanisms that allow it to be detached. It can be detached by dissolving the metal.
Okay.
It can be detached by opening a little valve, or it can be detached by melting some glue. But all of those allow this. And this is nice because if you put the coil in and you don't quite like how it's fitting or where it's sitting, you can pull it back.
You can pull it back.
And that's different. Those are called white strokes, and that's different from the red stroke.
Yeah, I think that's an important.
We've been talking, aneurysms are red strokes, meaning the blood breaks out of the blood vessel and then damages the brain by sitting around the brain and a lot of pressure on the brain.
Now, blood is very toxic outside of its normal route.
Yes, those places, that type, the blood outside the brain, the clot outside the blood vessel, is very painful.
Yes.
And so when people talk about a red stroke, particularly from a subarachnoid hemorrhage or an aneurysm, which we've been talking about, the headache is the most prominent part, and it is a severe, quotation mark, thunderclap headache, worst headache of one's life. Those people who've had it remember exactly how severe it was, and it will go on for, because of the blood, the irritation that you were talking about, will go on for weeks. Certainly for days it's a very prominent feature, but they will ache and have headaches for weeks and sometimes months.
patient that is experiencing neuroplasticity, is there good neuroplasticity and bad neuroplasticity?
Sure. You can. They say that practice does not make perfect. Good practice makes perfect.
Okay.
And the whole idea of turning on plasticity, of getting plasticity, is yes, you can have as easily habits that are slaves.
Yes.
And surly and uncooperative.
So initially, if a person thinks that they can't get better, and if they don't think they can get better,
I think that's probably it's a self-fulfilling prophecy.
It is a self-fulfilling prophecy.
I think we're set up to and probably we're set up to do what we choose to do, and that continuing to choose it can be extremely, extremely tough.
So keeping a positive attitude during recovery would not harm you. It would certainly help.
It's absolutely essential.
It is.
It's absolutely essential. The will to survive, the will to prosper, the will to endure is incredibly powerful.
I see.
And you see it all the time, and you see it families, the social groups. It's not just a one-person thing. It's an entire group.
Yes.
How it functions, it probably functions at multiple levels.
Okay.
Multiple levels. There's certainly cellular levels, growth hormone, other things that kick in. There's also societal support. I think it's absolutely critical.
It's all encompassing.
It's all encompassing. It's not a one molecule gets bumped a little bit. It's not your
and there's no prescribed time that this can take place at either. It's like snowflakes for each individual. Every snowflake's different. Every individual will experience a different amount of time.
Yes, and there are probably plateaus.
Right.
Probably everybody has their own curve, and those curves are also very specific and may be different for different functions.
Right. Absolutely.
But the amount of work can be breathtakingly huge.
Yes.
It's not like.
So it's a whole philosophy a person would need to adopt to get as far as they could to try to endeavor to do things on a daily basis to improve their recovery.
Yes. Yeah, and
okay. Anything else that might be beneficial for viewers to listen to here?
Well, I think there's a lot of possibilities that are coming. I think people should be very, very hopeful. And I think knowing the signs of stroke are critical.
Call 1-516-804-8495, and we will send you a refrigerator magnet for free that shows you the signs of stroke, and get them while supplies last. Thank you, John.
Thank you. Great seeing you.
Take care.
I'll take one of those.